Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great knee arthritis mobilization and pumping exercise to help with swelling and arthritic pain. Hope you enjoy. So this is a great exercise if you have knee arthritis and swelling in your knee, either under your kneecap or behind your knee. It can also be used for injuries such as sprainings and strains, degenerative meniscus problems, meniscus tears even, because it's a non-weight bearing exercise that helps to pump the fluid in and out of your knee, stimulate the healing of soft tissues, and help coordinate neurologically proper mechanical corrections to decrease the stress on your knee. So we're going to sit on a seat that's high enough so that our feet do not touch the ground. We want to make sure that we have an area so that when we bend our legs, we can bend our feet back underneath our sitting surface. If I have a normal chair that blocks me from going back, that's not going to be good because I want to get as much extension and flexion or bend to the knee as possible. So I'll need an area underneath the seat where I can bring my feet back. What I want to do is I want to sit and make sure that my alignment is correct. Now, knowing what your unique posture and mechanical stability issues are of not only the knee joint, but the hip and the ankle and the foot are very important for this exercise. Because as we're extending and flexing the leg, we want to be utilizing these corrections. There's fascial linkages from our hip and lower back that extend all the way down that affect our knee, as well as following all the way through to the foot and the ankle. So for instance, if we have a problem with hip rotation, meaning we like to stand or sit with one leg slightly turned out so that the kneecap isn't straight, we want to make sure we're correcting that so we have good alignment. If we have a tendency to have a bow-legged or a knock-kneed posture, this would be knock-kneed or genu valgus, or bow-legged, genu varus, when we stand or when we move. We want to make sure we're correcting that also in relationship to the ankle. Typically, people with a valgus stress are going to have to move the entire knee joint out and swing the ankle in to get that perpendicular alignment of the center of the thigh and hip right behind the center of the knee and the ankle. If you have a knee rotation problem, a lot of you out there with knee problems have a tendency to externally rotate the shin or the knee. Whereas you stand, your toes point more outwards than your knee does as you squat and as you walk. You're going to want to make sure you internally rotate the lower leg or the shin so that, again, the center of the thigh, center of the knee, and the center of the ankle and foot are all pointing straight ahead perpendicular to your body. If you're not sure what your unique mechanical issues are, I invite you to go to either the Posture Size or the Pain Free and Fit websites. We have a free body analysis there. You can learn what your unique postural asymmetries are. So let's begin. Once we align ourselves up, we're going to simply straighten the knee slowly using a range of motion that's comfortable. So if I get to a point that starts to hurt, I'm going to stop right there, hold for 2 seconds, and then I'm going to slowly bend my legs straight back. Now I'm trying to keep in that same alignment pattern. As I come forward, there's a natural tendency as I extend or straighten the knee for the shin to externally rotate. That's called the screw home mechanism of the knee joint. So if I have a tendency, for instance, to externally rotate that lower leg, as I extend out, I want to break or hold that from overly externally rotating. I want to hold that in just a little bit so I'm aiming for more of a straight rather than external rotation. If conversely I had an internal rotation problem with my lower leg, I'd want to emphasize external rotation as I extend or straighten the knee. As I come back and hold for 2 seconds, I'm again going to be using a range of motion that's comfortable on my knee, not going into pain, but just to the point of a little snugness or tightness. The knee has a tendency to internally rotate. That's normal mechanics, meaning that the shin bone is going to turn inwards or the toe is going to pigeon toe in the more that I bend. If again I have an external rotation posture of my lower leg, my shin bone, I want to emphasize now the range of motion as I'm bending my knee backwards. What that's doing is it's training the knee to correct its normal mechanical dysfunctions and pull all the fascial linkages that are affecting the knee from the ankle, from the hip, back into a more normal alignment. So as we're pumping the knee joint, going back and forth, holding for 2 seconds at each point, we're thinking about those corrections. This is a nice, easy way to do that that's not going to irritate the knee because we're not weight bearing, as opposed to a squat or a lunge or a stair step. That's going to be too much compression on a knee joint. This is what we call an open chain exercise, meaning that we have a freedom of motion in the air that we're controlling. It really makes corrections much easier and stresses the knee joint. So we're going to do these repetitions back and forth for between 15 and 50 repetitions. Now, here's the key. If as you're going along, you're saying at 15, that's pretty tiring, my knee has had it, you don't want to go that far. You want to stop at a point in your repetitions where you can say, I could easily do 2 or 3 more times this amount. So if I'm stopping at 20, I should say, I could have easily done 40 or 60, but I'm stopping at 20. This is a mobilization exercise, not a strengthening exercise, so we don't want to push it to fatigue. We just want to work within what's comfortable. We can do this 2, 3, 4, 5 times a day. It's excellent for pumping out that fluid, stimulating proper healing mechanisms inside the knee joint, using the body's own healing mechanism to heal sprains, strains, peripheral meniscus tears, arthritic degeneration. The cartilage in the meniscus in the joint is getting a pumping mechanism back and forth. Cartilage and meniscus in the knee rely on something called imbibition, which is the process of fluids pumping in and out. They don't have deep blood supply, so they require motion for healing. They require motion for bringing nutrients in and out of those damaged tissues. As you're coming out and straightening your knee, if you have a tendency to laterally track your patella, meaning your kneecap moves to one side, that also you know in your analysis, you want to make sure that you're tensing your kneecap in, waking up that VMO muscle. We have other videos explaining kneecap tracking function and how to align that properly. So you're thinking about all these corrections as you're bending and straightening your knee, keeping in mind your specific corrections as you go back and forth. As the set goes on higher in reps, don't be surprised if your range of motion increases. That's normal and that's actually healthy, but always stick within a pain-free range of motion. I've used this exercise myself and with many of my patients and clients. It gets great results. It's a nice low-load exercise. Just make sure you sit on something high so you don't have to pick your leg up. You have a nice, easy swing back and forth. There are other knee mobilization exercises and other videos. If you'd like to learn them, please subscribe to our channel. We have lots of great knee rehab and self-treatment protocols available here as well as on our website. We take this particular exercise and others from our knee self-healing treatment program in the Pain Free and Fit Self-Help series. If you'd like to help me share this wonderful information with other people suffering with knee arthritis and pain, give me a thumbs up below, leave your comments and questions. I'll do my best to get back to you. I hope this exercise helps with your knee pain and arthritis.